July 5th, the new National Health Service starts.
The NHS is heading for a special anniversary. It is 69 years since its founding father, Nye Bevan, launched what he called the biggest social experiment in history.
Disease.
A service free at the point of use that would shepherd post-war Britons from cradle to grave.
The doctor should be your servant, not the state's servant. You should choose him, choose or change him.
But as the NHS heads for 70, a service dedicated to saving lives is itself in a critical condition.
Hospitals have been under huge pressure this winter. Social care already is in crisis.
It's held together by sellotape and brown paper.
I would like to say to the politicians, we will not accept the privatisation of our NHS.
There are going to be funding pressures on health systems across the world.
Strike action has to be taken. It may sound militant, but it's the only way that people will listen.
The NHS is in trouble. Last winter was the worst ever for patients, with hospitals struggling to cope as soaring demand left thousands queuing on trolleys and wards full almost to capacity. It comes after the biggest funding squeeze in NHS history and 7 years of pay restraint under Conservative-led governments that has seen junior doctors go on strike and nurses threaten to. The recent cyber hack and the remarkable response to the Manchester terror attack are a reminder of our reliance on a service that the public claim to value above all others. The Queen recognised the commitment of NHS staff after the attack, but politicians seeking election face tougher questions about how they will shape and fund the service to meet the fundamental challenge of soaring demand. The NHS is busier than ever. Last year, 22.9 million people were admitted to A&E, but hospitals struggled to cope and missed the target of seeing 95% of patients within 4 hours, managing just 89%. Pressure is only going to grow because patients are changing. We're getting older and living longer with complex conditions, which means we need more care in hospital and when we leave. In 2015, there were 11.5 million over 65s. By 2035, it'll be 16.3 million. And while demand for NHS services is rising at 3 to 4% a year, funding is growing by only 1%. Unless that gap closes, patients may suffer. The man currently in charge is one of the most recognisable and controversial members of Theresa May's government.
Nothing to pay some here.
Jeremy Hunt has been Health Secretary for almost 5 years, but the government's record is so contentious, he's facing a challenge from a doctor representing the National Health Action Party in his constituency. And the issue dominates local hustings. Hunt's critics say Conservative policy has betrayed the NHS. He stands by his record, but says future funding depends on the Brexit deal Britain gets from Europe.
The question on voters' minds is, which party can they trust to actually deliver that extra funding? Is it Theresa May, who will keep the economy safe by getting a good Brexit deal, or Jeremy Corbyn, who frankly can't even get his own party to agree about Brexit? And I think what we're saying is, now as Conservatives, we are committed to the NHS, committed to the social care system, and we will deliver the strong economy that can fund it safely going forward.
Hunt's southwest Surrey seat is in one of the most affluent corners of the country, but his constituents are not immune to ill health and share national and local concerns.
I'm a cancer patient with a very aggressive form of prostate cancer, and I've been given extra time as a result of the treatment that I've received. So I find it very difficult to criticise the National Health.
I had 2 strokes, being in the Royal Surrey. I'm disturbed that they're going to move the stroke unit.
As a child, I had an experience of what it was like before the NHS service, and so remembering the GP used to come and visit us at home, and then my mother having to pay him. And then after that, enjoying the benefits of the NHS.
The reception for Hunt is not always so polite.
Mr Hunt, how does it feel to be demolishing the NHS?
Hello. This is what happened when he visited St Helier Hospital in Sutton, threatened with closure last month.
How do you feel about that, Mr Hunt? Do you sleep at night?
If you want to see what the NHS means to some people, meet the locals who use the hospital.
I wrote this song, I tried to get a message out, and I want you guys to do the same in 2 weeks. Use your vote wisely. Here we go, one last time, come on. It's not safe, not fair, they just don't care. We did not sign up for this. Yeah. It's not safe, not fair, but they just don't care. We did not sign up for this.
It was built there in the 1930s to serve the biggest council estate in Europe at the time. That's the population it was built to serve. They're still there, and the numbers have probably doubled. The beds halved.
Negotiating our fate with a gun to our heads.
St Helier could be closed as a result of an NHS plan to make the most of scarce resources by better coordinating local services. That means in some cases they could be centralised or closed.
Thank you.
There are similar plans and protests across the country. This march was against the possible closure of Liverpool Women's Hospital. Critics of the reforms say they're an excuse for cuts and privatisation. But independent experts say the NHS has to change to meet demand.
The NHS needs to be honest with itself and the public about the unpopular but necessary changes in hospital care that will be required during the next Parliament. I don't expect whole hospitals to close in most places. What we need to do is concentrate specialist services like cancer care and stroke care in fewer hospitals, delivering better standards because they're concentrating on these complex services that can't be provided to the same standard everywhere.
The food is really delicious at the lunch club.
For Labour, closures are a red line, and their health spokesman, meeting constituents in Leicester, says they would halt current plans.
We're not opposed to changing services. We want to see more services provided in the community. The NHS hasn't stayed exactly the same over its 70 years. But the way in which this current reorganisation has been railroaded through is that local people haven't been involved. There are examples where local clinicians don't agree with the various different closures. And a lot of the time, hospital bosses have had to come up with these plans based on a financial envelope that isn't realistic. So what we're saying is, let's just halt them, let's step back, let's have a moratorium, and let's review them properly.
Labour believe their promise to increase NHS funding is their strongest electoral hand, and think their concern is shared by voters.
We need to be able to access it as quickly as possible.
Everybody busy. Doctors are busy.
Doctors are busy, reception say I'm busy. And 40-50 times the ring is there, but nobody picks the phone from the reception.
And has it got better or worse?
Worse.
Worst. Yeah, worst. It is worse.
They're feeling the strain in London too. This GP surgery in Vauxhall is busier than ever, but it's struggling to find doctors because of a recruitment crisis, and its senior partner is dismayed.
The NHS is in a strange place at the moment. It's held together by sellotape and brown paper. Why do we judge everything in the NHS by the hospital? It's a national health service, not a national hospital service. Why are we looking at easing the burden on A&E when the real burden is here in general practice?
Got your drink on the table, your Sophie special, waiting for you over there.
The greatest challenge for the NHS is our ageing population. We're getting older and living longer with complex conditions, and the older we get, the more expensive we are to treat. Residents at Hazelwell Care Home on Merseyside enjoy surroundings that are more boutique hotel than old people's home. It's a private home where care starts at £900 a week, but Marjorie is an NHS patient. She could have been a bed blocker, a patient who can't be discharged because they don't have the care they need at home. She was brought here at taxpayers' expense to free up a bed in hospital.
At least here you're allowed your own little bit of independence and things like that really, whereas hospital, they're so busy, aren't they? You're sort of left in your room or in your ward because the nurse has been overstretched really with lots of work to do, so of course there's no comparison.
Fixing social care is hugely complex, as Theresa May discovered when she was forced to reverse a manifesto pledge to abandon a cap on costs.
Nothing has changed. Nothing has changed.
What has changed is that social care is now at the forefront of the campaign.
Hello.
Hello again.
Nice to see you again. How are you?
The Liberal Democrats say social care is a priority, and former Coalition Health Minister Norman Lamb has long called for a cross-party approach. How difficult is it going to be to get away from the political head-to-head and persuade politicians to get out of the way of what health service and social care needs?
Sure. Well, I think interestingly, the very time to do this is straight after the election. And we're saying, within a month of the election, let's just set up this NHS and Care Convention. We're the 6th largest economy in the world. We're a rich country, relatively speaking. We ought to be capable of organising an efficient and effective and modern health and care system that meets people's needs.
Honesty has not been a feature of recent political promises about the health service. If this is a Brexit election, Vote Leave told us the EU referendum was about the NHS. Brexiteers walked away from this pledge the day after victory, but the money would be welcome. £350 million is about what it costs to run the NHS for a day.
All three main parties have pledged more money to the NHS, and it needs it. Sky News has revealed that hospital trusts like this one are running a combined deficit of more than £700 million, a figure the government did not want released until after the election. But the truth is, none of them are offering enough to keep up with demand that will only continue to rise as the population grows and the baby boom generation turns 70. That means whoever ends up in government is going to face major questions about how to fund the future of the NHS.
But even a blank cheque may not be the answer unless we change too, taking responsibility for how we live, what we eat and drink, and when we choose to go to the doctor could have a huge impact. Taking care of ourselves may be more important to the NHS than how we vote. Paul Kelso, Sky News.